I now recognize Dr. Joyce from Pennsylvania for 5 minutes of questions.
Thank you, Chairman Wenstrup and Ranking Member Ruiz, for convening the Select Subcommittee today. And thank you, Dr. Welensky, for appearing before us here today. As members of this Select Subcommittee, it's incumbent upon us to uncover the truth behind the destructive COVID-19 pandemic and the flawed policies implemented by our nation's public health officials. Millions of lives were lost, families were destroyed, businesses and livelihoods across our country were crushed, all while the uncertainty of the panic ensued. In these moments of uncertainty, those who swore oaths to protect often look to their elected officials, to their community leaders and public health organizations for guidance. However, misguided, erroneous, and often confusing policies were implemented. Contradictory statements were habitually made by the same officials charged with guiding the public through this widespread health emergency. This virus and related government policies led to vaccine mandates, lost jobs, supply chain problems, and the isolation of our nation's young people. In order to protect our constituents and the American public from future pandemics, we are working to understand the truth behind the coronavirus pandemic, and we've waited a long time for the answers. On March 29, 2021, you appeared on the Rachel Maddow Show, and you said, and I'm quoting now, "Our data from the CDC today suggests that vaccinated people do not carry the virus, don't get sick, and it's just not in the clinical trials, but it's also in real-world data," unquote. Yet, 3 days later, on April 1st of 2021, a CDC spokesperson had to walk back your own words and officially told the New York Times that, and again I'm quoting, "Dr. Welensky spoke broadly during this interview. It's possible that some people who are fully vaccinated could get COVID-19. The evidence isn't clear whether they can spread the virus to others. We are continuing to evaluate the evidence." Dr. Welensky, simply yes or no, does a spokesperson from the CDC going on record and correcting the statements that you made undermine and fracture the confidence in CDC leadership?
Dr. Joyce, I know you know that I was speaking in generalities, that we saw data and evidence that was over 90% that the vaccines were effective in preventing severe disease and death, and in fact in preventing symptomatic disease, and that once people had been vaccinated, even if they were to get infected, they were not getting sick and they were not able to transmit to others.
But Dr. Welensky, you stated that vaccinated people, and I'm quoting, "do not carry the virus." This fractures and undermines the confidence in your leadership. The CDC is the nation's leading science-based, data-driven service organization that's mission is to protect public health. Yet during the pandemic, there was continuously a countrywide perception of the shift about the nature and the risks of COVID. This is underscored by those inconsistencies in messaging, and unfortunately in your messaging, including a CDC spokesperson who had to walk back comments that you yourself made on television. In fact, it could be said that these inconsistencies led to the findings of a survey conducted by the Pew Research Center, where again I'm quoting, 57% of U.S. adults say false and misleading information about the coronavirus and vaccines has contributed to the problems that the country has faced dealing with the corona outbreak. Dr. Welensky, do you feel that any accountability regarding the public perception and the lack of widespread confidence in the CDC and its public officials, do you feel that that rests on the shoulders of leadership?
I think would dispute the framing of that question. I think that there is increasing confidence in the CDC and that there has been an undermining of scientific
We have polling from the Pew Research Center that says more than half of American adults felt that there was misleading and false information. Dr. Welensky, is the CDC not capable of accurately reporting to the country the generalities in a public health situation, specifically during the COVID pandemic?
Actually, we can get back to the generalities that you speak to, and that is the quote at the Rachel Maddow show that where I said they can't carry the virus, meaning they can't transmit it to others. That was true for the alpha variant at the time that I said it. Even those who might have had a positive test, who might have had asymptomatic infection, a breakthrough asymptomatic infection, were not transmitting that virus to anyone else.
But your leadership has fractured the American public's confidence in the CDC. We are trying to work together as a bipartisan committee to work forward to understand how this misinformation and how these comments are made and yet walked back just in a matter of a few days by a spokesperson from your own CDC. This committee wants to understand this further. I think that we are coming to conclusions as we work to shine a light on these problems. And I, again, thank you for coming here today. My time has expired, and I yield back, Mr. Chairman.